Good evening, everybody, and thank you for joining what is our fourth installation of these town halls presented by the Office of Queensborough President Donovan Richards. My name is Brent Weitzberg, and I have the distinct pleasure of serving as the Borough President's Deputy Chief of Staff and Queens COVID Czar. I would like to just give a few introductory remarks, thanking Department of Health and Mental Hygiene for taking the time to educate our communities, and a special thank you to Dr. Olsimbo Ige, who is ready to join tonight and field some questions and answers for the community. Dr. Ige is the Assistant Commissioner for Health Equity Capacity Building at the New York City's Department of Health and Mental Hygiene. She also serves as the Branch Director for COVID-19 Community Engagement. As we know, this pandemic was a devastating moment in our borough's history. And first, we cannot stress enough that all Queens residents must follow the city's core 4 actions, including staying at home if you're sick, wearing a mask, practicing good hygiene and washing your hands, staying at a social distance from others outside of your home by standing at least 6 feet apart. I'm proud to say that our office has distributed roughly over 30,000 masks, thanks to the mayor, the governor's office, and additional donations, along with various PPE and hand sanitizer. As we know, testing is a key component in the battle against COVID-19, and it's important that all New Yorkers have easy access and the ability to get tested. Many are now conscious about testing, and we see that in Queens has particularly some of the highest COVID positivity rates across all of New York City. For example, recently reported from February 15th to February 21st, zip codes such as 11355 had a 14.54 positivity rate, and Guyanese communities and zip codes such as 11419, which is Richmond Hill, South Ozone Park, had a 13.76% positivity rate. It's encouraging to see so many individuals getting tested, but we must do better. We must expand testing, whether that's at urgent care facilities, medical offices, or self-swab sites, and we must give more testing capacity to traditionally underserved communities, which have been hit hardest by COVID-19. Now, moving on to the topic we're speaking about tonight, vaccination. Here at Borough Hall, we're strongly encouraging all eligible Queens residents to get the vaccination as soon as they become eligible and as soon as more vaccines become possible. We want to ensure that there are plenty of sites in all regions of the borough. As we know, Queens is the gateway to the rest of the city. If you're coming into New York, you're coming in through JFK or LaGuardia. And we're so excited that City Field is a mass vaccination site, but we need to install more sites, especially in the vicinity of both of our airports. Too many lives have already been lost, and we cannot waste any further time in getting this vaccine to those who need it most. In particular, our Black, Latinx, East Asian, South Asian, Indo-Caribbean, and immigrant communities were hit hardest by the pandemic. So it's imperative that the city worked 24/7 to get the vaccines administered to members of this group. Additional PPE will also need to be distributed. So in conclusion, we've come so far in this pandemic, but we can't give up now. The fact that we're such a large diaspora of the population, there's a right to stand up for our country in response to the recent COVID-19 vaccine. When looking at recent reports, we must also have vaccine equity. Only 42% of white individuals have received at least their first dose, compared to only 15% of Asian individuals, 16% of Latino individuals, 12% of Black individuals, and 15% who identify as other. We understand that overcoming historical mistrust of scientific and medical institutions on the part of communities of color is not an easy goal to achieve. But the deep disparities revealed in the city's COVID-19 vaccination database are not justifiable. They're unacceptable and potentially fatal. So to guarantee an equitable recovery and rebuild from this pandemic, we must serve our historically underserved communities. Lives are on the line, and we must ensure that we do everything humanly possible to address these disparities and find solutions. But we're excited to be here tonight with Department of Health and Mental Hygiene, and we look forward to answering questions that the community will present. With that being said, I'd like to invite some of our elected officials and colleagues in government who are on the line to give a few welcoming remarks. I'm going to start with Assemblymember Neely Rosen. Assemblymember.
Thank you so much, Brent, and to all of my colleagues and Dr. Ige for putting this together. It's so critical that
you can see that.
It's so critical that we get vaccines into the arms of as many Queens residents as possible. And I'm ready to stand side by side with anyone who is ready, willing, able to do that. My parents just got vaccinated a week ago, and I can't tell you the relief that it brings me to know that they're one step closer to full vaccination. But I know that a lot of seniors, a lot of people in Eastern Queens feel like they've been left behind. And working with our colleagues in government, working with the borough president's office, I'm hopeful that in the coming weeks, we'll have better news for so many of our residents. Again, thank you so much for doing this and for educating Queens residents about what their options are.
Thank you so much. Assemblymember Cruz, if you'd like to give some welcoming remarks.
Thank you. Sorry that I interrupted. I just thought, wasn't sure if Nilly knew she was off camera. I'm really glad that Borough President Richards is taking this step to help educate our community. The number of people who continue to ask some very basic questions that that we should know, and that unfortunately the reality is our state and city government haven't done, or in our federal government haven't really done a good job at helping us and giving us a hand at educating our community. I happen to represent the epicenter of the epicenter, Elmhurst, Jackson Heights, and Corona, where one of our hardest hit hospitals is located. And people still have, concerns from how is the vaccine made to what does it really do to how can I become part of 1A, 1B? I mean, who is even in those lists? And I'm not talking about just folks who aren't in the mix. I'm talking about teachers having those questions, store owners having those questions. People that generally would have access to information don't have it. And so I'm very thankful that we're doing this. I look forward to hearing some of this information, and just really grateful that we get this opportunity.
Thank you so much. Assemblymember Barnwell.
Thank you very much for putting this together and having me as I wear a mask. And but obviously that's important, wearing a mask, right?
Right.
But I want to thank the Borough President's Office for their work, helping to get City Field up and running. That was very important. But at the end of the day, as my colleagues have said, I'm being very blunt. The vaccine rollout was horrible. And it's federal, it's state, and it's city. It's all three. And the executive honestly didn't get the job done. Every day I'm fielding call after call after call from seniors and others in the district who cannot find sites. Then they have difficulty obviously finding, they don't have the internet, right? Then they have to go on the hotline. And sometimes the hotline they don't even pick up. So, we dealt with this with unemployment, we're dealing with this with vaccines. So it's unacceptable. So I do appreciate Donovan Richards leading the charge on this and helping us and get more vaccines and get more appointments. And I appreciate the doctor coming on and giving us an update. So thank you very much. And I'll be in and out, but I appreciate everyone's service and thank you.
Thank you, Assemblymember. Senator Liu, would you like to say some remarks?
Thank you, Brent. Great to see everybody here. I think our wonderful Assembly members have already said it all. The vaccine is vitally important. We have seen a year that our community here in Queens and all throughout the world have seen the devastation that COVID-19 has brought to us and our families. We have lost so many thousands of fellow Queensians and New Yorkers, 500,000 fellow Americans, and millions of people all around the world. This is the greatest pandemic that the human population has ever suffered through. But after a really long and dark tunnel, we are now starting to see the light. And the distribution sites are up and running. Obviously, we still need to do more work to get the supply out there. But even the supply is starting to come about in more efficient and effective manner. So I think the borough president wanted us to get together to have this town hall to hear from our expert, Commissioner Dr. Ige. Thank you very much for joining us. And let's get the facts out there. Talk to our friends, talk to our family, our neighbors, talk about how important it is for each and every one of us to get the vaccine. The vaccine is one of the most effective vaccines ever in medical history. And I'm going to trust the doctors and the scientists on this. This is the only way that we can get life back to normal. If not only ourselves get the vaccines, but everybody else that we know, we need to, I'm sure Dr. Ige is going to talk to us about this concept of herd immunity and what's it going to take not only to protect ourselves, but everybody else around us so that we can finally reopen our businesses, including the bowling alleys and movie theaters, get all our kids back into the classrooms, have everybody go back to their jobs and resume life back to normal as we know it. So thank you to all who have been taking part so far. Thank you, Brent. Thank you to the Borough President, Donovan Richards, and thank you once again, Dr. Ige. And now let's get on with it.
Thank you so much, Senator. With the Senator's remarks in closing, I'd like to now transition to Dr. Ige for your presentation. So Dr. Ige, take it away.
Hi, everyone. I hope you can all hear me. I am very excited to be participating in this conversation and town hall today. And I want to say thank you to Borough President Richards and to the Senator and the Assembly people who have spoken and just reiterate how important it is to have information out there. I myself live in Queens, so this is a special event for me because I am a member of the community. And as you can see, this represents a microcosm of what Queens is about. It's about diversity, and we are very, very committed to preserving that and our vibrancy and our livelihood and our economy and just going back to normal and enjoying what living in Queens and being a New Yorker is all about. So I will start my presentation, Anna. So I want to start by giving you a quick update on where we are. Next slide. So we have been dealing, the previous slide. We have been dealing with this pandemic for a while, and we tend to become, oh, we've been a little complacent, but I want to remind you that COVID is still a thing. It is still present. In fact, January was still named as one of the deadliest months for COVID. So we're not completely out of the woods yet. You will see the trends there. We're grateful that we are seeing a decline in the 7-day average, but you will see there that, we got to a pretty high peak again recently. So we are working very hard to make sure that every New Yorker has the information they need to stay safe and to protect themselves, their families, and their loved ones from this deadly virus. And as you will see, there's red all over, and you will see that, Queens is not left out. We heard Brent talk about how Queens has been an epicenter of this pandemic, and we're all working hard to reverse that trend. Next slide. So right now, we are encouraging people to still continue to use the tools that we know work. The vaccine is here. We're very excited about it. It is a very, very strategic tool in our toolbox, but there are also other tools that we've been using and they have been effective. We want folks to continue to get tested and to separate from others immediately if they test positive. The core 4 prevention strategies are still relevant. They're still working. They're still effective. We continue to encourage everyone to stay home if they're sick, if they've tested positive for COVID, if they have recently traveled, or if you've been in close contact with someone who has had COVID. We want to remind everyone that wearing a face covering when you're outside your home is protective of yourself and of your family and loved ones, whether you're indoors or outdoors. If there are other people in the room, please wear a face mask whenever possible. Keep 6 feet of distance from members who are not from your household, and please wash your hands or use hand sanitizer. These things have kept us safe and they're still important. Again, avoiding travel and large gatherings is important, is a protective strategy. It will keep you and your family safe. So please remember that these things are still important. We encourage everyone, all the residents of Queens and all New Yorkers, to follow the commissioner's advisory for older New Yorkers with underlying health conditions and their household members and caregivers. Next slide. The vaccine is here. We're excited. We are developed this new NYC vaccine for all because the vaccine should be safe, free, and easy for all New Yorkers. So we will tell you a little more about how we're making sure that this is true for everyone. Next slide. So these are some numbers that we feel are important for you to know. As of today, we have received over 2.2 million doses of the vaccine in New York City. That's the first dose and second dose combined. Over 1 million New Yorkers have received at least one shot of the vaccine. So that is a remarkable milestone. 1 million New Yorkers have received this vaccine already, and over 500,000 have received their second dose. So we are getting closer to the end of this pandemic, and we're very excited about that. Next slide. Next slide. Even though we're excited about the numbers, there are still some areas of concern. You will see that there are still some differences in vaccination rates based on race, ethnicity, and age. This data excludes adults for whom race and ethnicity was not known. So this is not complete information for everyone who's been vaccinated, because some data did not indicate race and ethnicity. But for the data that we have for race and ethnicity, you will see there that while Black New Yorkers, only 11% of them have been vaccinated, 17% of Latino population, 19% of Asian, compared to 37% of those who identify as white, for those who are under 64 years of age. And when you look at those who are above 65, 45% of those who identify as white have received a vaccination, compared to 13% of Asian population, 15% of those who identify as Latino, and 12% of those who identify as Black. So we are working very hard to ensure that all New Yorkers, regardless of their race or ethnicity or age, have equitable access to this vaccination. And we are working hard to make sure information is available to all New Yorkers to make an informed decision about vaccination. Next slide. Now we have data on vaccination by zip code. So again, you can see across the city, it is not been uniform. Some people have received this vaccination at higher rates than in some other populations. And you will see that even within Queens, we don't see as much blue there as we would like. So again, another reason to work hard to ensure that every New Yorker has equitable access to this vaccination. Next slide. So this is why we are very emphatic about NYC Vaccine for All. We focus on equitable distribution, including acknowledging history and current experiences of racism and bias in healthcare and communities significantly impacted by COVID-19. We know that there are many of our communities of color because of their past and current experiences, are more hesitant to engage with healthcare because of the mistrust in government and health systems. And this it indicates a need for us to work harder to ensure both access to and confidence in the vaccine. So we are committed to doing the work and led by the Vaccine Command Center, which is the interagency operation with New York City Health Department, the Health and Hospitals team, the Test and Trace Corps, and NYC Emergency Management and other agencies. We are working very hard to build confidence in this vaccine and increase access, and equitably so, across the city. We have been working on building partnerships with federal and state governments, the community, elected officials, other city agencies, and our other partners, community partners, to ensure that the reach of the information we're providing is increased across the city. Next slide. We want to share with you some basics about the vaccine. We heard, people are still not fully aware of what these vaccines do or how they work. So I want to start by saying these vaccines are safe, and they are safe because they have undergone rigorous testing, different stages of review before they were authorized by the Food and Drug Administration. These vaccines are recommended. Even if you've already had COVID or you have antibodies, these vaccines will only boost the antibodies you have. There is no negative impact in getting vaccinated, even if you have had COVID or you still have or you have antibodies. This vaccine does not contain the virus. The way this vaccine works, it uses the mRNA technology, which helps your body to read the instructions on how to develop antibodies without being exposed to the virus. So it only tricks your body into developing antibodies without exposure to the virus. So it does not contain the COVID virus. And this vaccine does not alter your DNA. The mRNA, which means messenger RNA, it's only a messenger. It carries instructions to your body on how to produce antibodies. And once the instructions are read, the mRNA and antibodies developed, the mRNA is destroyed. So it does not alter your DNA. We have two vaccines that have currently been approved or authorized for use in emergency by the FDA, the Pfizer and the Moderna. Both of these vaccines are mRNA vaccines. They both require 2 doses. The second dose should be given 21 to 42 days apart for Pfizer, or 28 to 42 days apart for Moderna after the first dose, or as soon as possible after that. So if you, for any reason, miss your appointment, or you are not able to go back exactly 21 days after, you have a window of up to 6 weeks after your first dose to schedule your appointment and get your shot. And the same for Moderna. If for any reason you're not able to schedule within this window, please do so as soon as possible after that. You will only require 2 doses in total. You will not need to start all over again, even if you miss the window. Second dose appointments must be made at the same location as your first dose. Even after getting vaccinated, please remember to continue wearing your face coverings and keeping physical distance and limiting gatherings, because we still have a critical mass of New Yorkers who are not yet vaccinated. So until such a time when we know that most people are protected, we want you to continue to use these preventive strategies. We know that you are protected after being vaccinated, but right now, we don't have enough data to know if you can still transmit the virus even though you are protected. So we encourage folks to continue to practice these preventive measures to keep everyone safe until such a time when we have more people vaccinated and we can change or update this guidance. Next slide. So how does the vaccine get to New York City? The vaccine, it's the federal government that manages the distribution of vaccines from the manufacturers to states and localities. So NYC receives an allocation proportionate to its population. And the Department of Health website, we now have the data about vaccination distribution and uptake. So every day you can see how many doses we have received and the doses we have on hand for dose 1 and for dose 2. But it is true that supply is extremely limited. We need additional vaccines from the federal government to be able to open additional sites, to be able to offer more appointments, and to be able to vaccinate more New Yorkers. So you will see that, you know, the doses we have is not sufficient to go round just yet. And so we continue to wait on the federal government for renewed supply of the vaccines so we can, you know, expand the sites and expand the appointments to more New Yorkers. Next slide. And the limited supply means that we need to phase distribution and some people need to go first. And so you will hear about all the eligibility talk and phase 1A, phase 1B, what does that mean? So this is based on the CDC's guidance, and New York State determines prioritization for the vaccine and the distribution timeline. Again, this is necessary because we don't have enough for everyone just yet. And so people who are at increased risk of exposure or those who are more likely to have severe COVID, they are the ones going first. They are being prioritized. And this includes healthcare workers, people who are 65 years and older, residents and staff in nursing homes, homeless shelter, and other group residential facilities, because these individuals are more exposed because of the residential conditions. Certain frontline essential workers and people with underlying health conditions are also eligible now because, again, these essential workers are more exposed due to the nature of their job, and those with underlying conditions are more likely to have severe COVID, so they get to go first. So we have a complete list of eligible groups on the website at COVID vaccine distribution. So if you're not sure if you're eligible, that's one location where you can check to get additional information on who's eligible. This phase distribution will still need to happen for some time because we don't expect the vaccines will be widely available until at least mid 2021. We know that, you know, the federal government is making arrangements to have more vaccines produced. And so we are optimistic that, you know, supply will be increased soon. But our expectation is that it will be until like mid-year before we can have vaccines available for everyone. And so we encourage you to be patient and to wait your turn for the vaccine so that those who are more vulnerable can go first. And those who are eligible right now can get the vaccine. Next slide. And so because not everyone can go first, we want to make sure that, you know, we're enhancing access and building confidence. How do we ensure that our response is grounded in equity and that we are using this focus even with our vaccine campaign? we know that successful and equitable distribution leads to enhancing access and building confidence. So we are using the data on uptake to show where there are disparities. And this disparities also reflects national trends. And we are also using data on prioritization and eligibility, and to address any lack of confidence within communities of color, where we know we need to do more work to build trust and to provide information to folks. So working with Racial Inclusion and Equity Task Force, we have increased the number of equity neighborhoods from 27 to 33 neighborhoods. And this is a reflection of our recognition of the impacts of COVID in certain neighborhoods, that these neighborhoods have borne a bigger burden of COVID relative to other neighborhoods. This is not to say that not all neighborhoods have not been impacted, but we know that the burden has been higher on some neighborhoods. So that expansion to 27 and to 33 neighborhoods is in recognition of that. Next slide. The city is expanding sites. We are ensuring distribution to pharmacies and local providers as supply increases. And if you're eligible and you want to make an appointment, there are two ways you can do that. You can do that online at vaccinefinder.nyc.gov. And if you're interested in getting vaccinated at a site operated by the city, you can call 877-VAX4NYC to book an appointment. So I want to say that, yes, this vaccine finder site will show you where vaccines can be provided in your neighborhood. It doesn't necessarily mean that all locations will have appointments available when you go look for them. So it may be necessary to check a number of times before you are able to secure an appointment. Again, this is because there's not enough doses for everyone right now. We're continuing to work on improving the user experience. So if you go to the vaccine finder, nyc.gov right now, and for locations that are operated by the city, and you can identify those with the NYC prefix, you will be able to see immediately if they have first dose appointments available or they're only second dose appointments available. Again, this is to improve the user experience and to make information easier to find. We're also partnering with the Department for the Aging, DIFTA, providers and NYCHA developments and CBOs to help community members secure appointments in 33 neighborhoods. So through these partnerships, we're making sure that older New Yorkers who are not able to go online and book appointments get support from all of these partners to help them schedule their appointments. We also have transportation options available to seniors who need them through the call center. So if you're 65 years and older and you need support to get your appointment, you can do so by calling the 877-VAX4NYC number for additional information. Language access is available at city vaccination sites, and including ASL support for those who need that support. And we have a website and hotline, as well as on-site information in several different languages. Next slide. Again, we know we need to do some work to build vaccine confidence and to make sure that all New Yorkers have access to information about healthcare resources, about the vaccine, about where to go, and what is in this vaccine, and how does this vaccine work. And so we're working with trusted messengers, community leaders, to help them spread accurate information and help community residents navigate the process. So we have trainings 2 times every week to equip partners with information to disseminate to their network. We are doing outreach through town halls like this with elected officials, with different communities. We're hosting community conversations where people can ask questions and we can provide answers about this vaccine. We are having training sessions with community partners, community-based organizations, faith-based organizations who are interested in learning more about the vaccine so they can better support their communities. We also have on-the-ground canvassing. So in over 100 zip codes every week, we have canvassers out 3 times a week, distributing flyers, distributing palm cards, providing face masks, and giving people information about the vaccine. We're also doing robocalls, mailers, text, to get information out to the communities. So we have fact sheets and posters in over 13 different languages, again, to make sure that information is available to New Yorkers. And finally, we have a vaccine facts video campaign to address the key drivers of vaccine hesitancy and to bust the myths. We know that there's a lot of misinformation on social media. People are worried, they see all kinds of things on TikTok. So, we want to make sure that, there are facts out there about the vaccine to counter this misinformation and bust the myths. So we have videos, again, with different languages on YouTube, where you can learn some more about this vaccine. Next slide. So as community leaders and people look up to you for information, for guidance. And so we want to make sure that you have information and you have resources and you know where to go to get additional information. So for information about eligibility, these are some locations where you can find information on how to get the vaccine, vaccinefinder.nyc.gov, or call in the 877 VAX for NYC number. That's how you can get an appointment if you're eligible. And we also want to continue to reinforce the messaging about the core 4 prevention strategies, because again, we know that not everyone is vaccinated just yet. These are vital tools in our toolbox, so we don't want to throw them away. And they're still very effective in keeping us safe and protecting us. We have the main vaccination information page there and the link there. We have a facts page where we have a lot of questions and answers, frequently asked questions about the vaccine, and the YouTube link where you can get access to the videos. We want to encourage you to share your stories on social media. People are worried about this vaccine. The more we see people, New Yorkers, people we know their names, they are our friends, they are our neighbors, they are colleagues, they are family. The more we see stories of people who have been vaccinated and are doing good and are doing well, the more confident we feel about, getting vaccinated. So we want to encourage you to share on social media stories about people getting vaccinated. Again, it's exciting to know that over 1 million New Yorkers have already been vaccinated. This is no longer abstract. It's not just the numbers we have from the clinical trials. These are real people, New Yorkers like ourselves, now that have been vaccinated. And we have their stories. We know their names. We know where they live. So the more we share the stories, the more people feel confident to take this opportunity when it's their turn. Next slide. And that's the end. And I know that there are some more questions, and I'm here to respond to other questions that you may have.
Well, this is fantastic, Dr. Ige. We really, really appreciate the very thorough presentation and all the great information you were able to provide. Switching now to the questions.
Terrific, Dr. Ige.
Thank you.
Switching now to any of the questions presented here by the constituents. We're going to talk about locations throughout Queens. Obviously, the borough president's office wants to see vaccination sites all throughout the borough, in every part of the borough. But a question that was presented here, I'll combine two. When will there be locations in Northeast Queens as well as Eastern Queens?
Yes.
So if you'd like to take that.
Yes, vaccination sites are still limited to vaccination supply. There's no value added if we open a vaccination site and there are no vaccines. So until we get more vaccines available, we cannot promise that more sites will open, but as supply increases, then more and more sites will open. Our hope is that by mid-year, vaccines will be available in the usual places you get vaccines for flu, in every pharmacy, your primary care provider. We don't want everyone struggling and trying to book appointments as things stand right now, but we're waiting on more supplies to make that happen.
Great. Very interesting question just presented. From a legal standpoint, vaccines are not mandatory, correct?
Correct. Getting vaccinated is a personal decision. The city and the state are not making this mandatory for everyone, but we want to make sure that all New Yorkers have information and no one is prevented from accessing this vital life-saving intervention because of lack of information or because of fear or misinformation. So ultimately, what we want to happen is everyone has fact-based scientific information about this vaccine so they can make a decision. But at the end of the day, it is a personal decision. It's not mandatory.
Great. Proud to say our office just received a compliment. Thank you to the BP's office and all those involved for getting more vaccine hubs in Queens. Second part of the comment question, Dr. Ige, is the second dose of the vaccine stronger than the first dose?
So I'm going to tell you a little about this, how the vaccine works, so you understand why you may see a difference and how people react to the first dose and the second dose. So a vaccine is supposed to train your body to develop antibodies. So after your first dose, you develop a level of antibodies. And then after the second dose, you develop even more antibodies. And because the reactions you get from the vaccine is based on what we call reactogenicity. They are reactions that develop when your body is building up antibodies. So as you build up more antibodies, you will notice that you see some symptoms more often after the second dose than the first dose. And that's the reason why. It is the exact same dose, it is the exact same vaccine. The only difference is now you're developing more antibodies after the second shot.
Thank you. Question proposed to us, and I don't know how much DOH, MH could answer this, but it's in relation to local pharmacies vaccinating. From the constituent, please explain why, as I discovered today, that even if you are eligible due to a comorbidity issue, if you are not 65 and over, you will not be allowed to get a vaccine at a pharmacy site, such as Costco, Rite Aid, or Walgreens.
That is correct. At this time, pharmacies are only providing vaccination to those who are 65 years and older. So if you have a comorbidity and you're not yet 65, you will have to schedule your vaccination at a different location. So pharmacies are only, right now, providing vaccination to those who are 65 years and older.
Question regarding the vaccine website. Frustration over how the vaccine was developed. People are looking for a vaccine and they should be able to create a basic profile once, not every time they're trying to access a provider.
Yeah, and that is true. And we acknowledge that, again, like we said, we're trying to improve the user friendliness of that site. There are some limitations though, and that is not an excuse, but I will tell you why things look the way they do right now. Right now, we have different providers who are providing or distributing vaccination. We have some locations that are operated by the city. They can be operated by the Department of Health or Health and Hospitals, so you will see those differences. We have some locations that are operated by the state, so this is a state-run site like Javits Center, City Field. You will see those, again, with a different interface. And then you have pharmacies, and then you have private hospitals or providers. All of these different providers have different appointment systems. We don't yet have a centralized appointment system where all providers can book appointments. So due to that, you will see that you may need to create profiles depending on the type of provider that you have selected. And we know that that's very frustrating for a lot of New Yorkers, and we're working really hard to see how we can work towards a centralized process.
Dr. Ige, as venues start opening up, can a venue such as a catering hall request a COVID test from each guest before entering?
If you're having an event with a large gathering, we'll say it's very difficult to enforce COVID tests from anyone before entering. This is America, and this is, New York City. Everybody has a right to do, go anywhere that they want. So making a test mandatory will be difficult to enforce, but we want everyone to take the initiative themselves to get tested if they're going to go to a large gathering and other people are going to be exposed to them. But a more effective strategy may be to limit gatherings, large gatherings, in the first instance, rather than mandating everyone who comes in to take a test before doing so. That's really challenging to enforce.
Three-part question here from a constituent. As an African American, there is high skepticism and mistrust that is rightly justified within our community due to us being victimized in the past, i.e. the Tuskegee Airmen experiment.
Right.
My questions are as follows. Number one, what are the benefits of taking the shot when one could still contact COVID-19 after getting the shot? Do you want me to read all three, Dr. Ige?
Yes.
Do you want to take it in piecemeal?
I think I'll take it one after the other.
Okay.
I want to acknowledge the trauma and the experiences, particularly in the African American community. The Tuskegee Experiment is an example of how opportunities for healthcare were withheld from those who needed it. For the Tuskegee Experiment, African American men who had syphilis were deprived of treatment even when penicillin became available to treat syphilis. And that is an unconscionable thing to do. And it's regrettable that people had to go through that experience. And it is the reason we're working very hard right now to make sure that no New Yorker, no person of color is deprived of the opportunity to access healthcare resources because they did not know that resource is available. So that's one strategy, that making sure every single New Yorker gets information about what they need to do and where the resources are that they need to stay healthy. So that's one piece. The benefits of the vaccine. If we look back this last year, when we say that this is a pandemic that has led to the death of over 21,000 New Yorkers, that has led to the demise of over 500,000 residents of the United States of America, more people than have been lost in any war, 500,000 people in 1 year. And we have a game changer now. We want to make sure that every death that can be prevented is prevented. We have come through a period in this city where there were bodies being loaded in refrigerated trucks, where hospital beds were full to the brim. And we all live in Queens. We saw this with our very eyes when we were running around looking for ventilators. So this is the reality of the pandemic we're dealing with. We know it's been a while, but we don't want to forget how severe this was, the impact of this on every New Yorker. So now we have something that can prevent hospitalization, that can prevent people from dying, that can prevent people from getting sick at all. 95% efficacy. It is the best deal that we can have. And we know that pandemics have been successfully handled with vaccines. I like to give the example of smallpox. We don't even know what smallpox is anymore because of vaccines. It's been completely eliminated from the face of the earth. Nobody has smallpox anymore. Nobody has polio anymore. Measles, chickenpox. Growing up, chickenpox was common. Now you look around, how many people actually get chickenpox these days? This is what vaccines can do. And this is why we may want to make sure everyone has access to this intervention that can prevent people from being sick, being hospitalized, and dying. It is preventable, and if we can prevent it, we want to make sure everyone gets that opportunity. So this is the benefit. That's why this has been offered to anyone who wants it.
Similarly, Dr. Ige, a constituent had offered follow-up questions, but I believe you've touched on them already. They're saying that without the shot, the rate of recovering from the virus is 99.8%. I don't know where that number is from, but the percentage is said to be lowered to 95% after getting the shot. Can you touch on that? Is there any validity to the 99% rate of recovery? I haven't heard it. But.
Yes, if we had those rates, we would not be worried about this infection. Again, depending on the age of the person who's infected, but we know we have data to show that this infection can be fatal to anyone of any age. We know that it can lead to severe disease to anyone of any age. At least 10% of those who contract COVID have long-term effects for months, even after they recover. And now we have something that can prevent that from happening. So, I mean, should we then say, oh, let us gamble and see if you're one of the lucky ones who will recover, or you're one of the ones who will die, when we have something that can actually prevent that from happening? Right. So those are the odds there.
Similarly, there's a legal question presented. I don't think this is within the scope of DOH-MH, but it's, why are pharmaceutical companies indemnified from being sued by the government if the vaccine is not effective? To me, that's outside of the scope of the conversation, but if you want to touch on that.
Yes, generally, for any medical intervention, you will provide information, and this, you will provide consent that you actually want to receive this vaccine, and you will have all of the information about the potential side effects of these vaccines. So again, because this is not made mandatory, this is, informed consent process, that those are some of the the background work that's need to be done to make sure that individuals are aware, of what this medical intervention will provide, and all of that. So the indemnification and all of that, I will leave that now. But we want to make sure that everyone has complete information about what is in this vaccine, what it does, and how it works, and what side effects it is possible.
And with that, vaccines are usually tested in stages.
Right.
How did that work here with the staging?
Okay. So there are 3 phases of clinical studies that are required for any vaccine. The first phase is you try, the vaccine is used in a few people, less than 100 usually. When you are able to demonstrate safety and efficacy in that group, then you can move on to a larger group, which is phase 2, usually several hundred people. If in that several hundred people, you're also able to demonstrate safety and effectiveness, then you're able to move on to several thousand people. And so that's phase 3. For Pfizer, that involved 44,000 volunteers. 25% of those were identified as Latino, 10% identified as Black, and about 4 or 5% identified as Asian. For the Moderna, that involved 30,000 volunteers, again, with similar percentages from communities of color. So both vaccine involved people of color. Safety and efficacy was similar across different racial and ethnic backgrounds. So those were the stages that were involved before this vaccination was authorized for use in the general public. And now there is a phase 4 where safety and efficacy continues to be monitored even after this has been used in the general public. So those are the steps in the clinical studies process.
Thank you. I do want to acknowledge, I believe Senator Comrie was on the line. I don't believe he's on the line right now, but I just want to acknowledge Senator Comrie's presence and thank him for joining us. And I see Council Member Koo has joined us. Council Member, if you'd like to give some brief remarks, the floor is yours, sir. Sir, you're on mute. Please unmute yourself, Council Member.
Hello, everyone. Good evening, everyone. I want to thank the board president for doing this vaccine information town hall. And I'm sorry that I didn't attend at 6 because I was have an appointment with a doctor. So so all the information are given today, and I encourage everyone to do vaccination as soon as possible when you are allowed to. Like right now it's 65 for first line workers. So later on you will be open for other groups. So I encourage everyone to do vaccinations as soon as possible so that we can get back to normal lives in 4 or 5 months, I hope, right? So thank you.
Thank you, Council Member Koo. We appreciate you taking the time to
Yeah,
join us. Dr. Ige, you had explained that people with comorbidities under the age of 65 are not eligible at drugstores, but are eligible at other sites. But you did not explain why. Can you please explain why? And when will non-chain, independently owned neighborhood pharmacies be getting the vaccine? Just to preface this, Dr. Ige is a representative of the New York City Department of Health and Mental Hygiene. She's not a representative of Walgreens, Costco, Rite Aid, whatever the case may be. This may be outside the scope of her duties, but Dr. Ige, if you have an explanation, by all means.
I will speak to it. It is a strategy to make vaccine easily accessible to older New Yorkers. We want to make sure that seniors are able to access the vaccine closer to where they live. And so they are being prioritized at pharmacies right now. So that's the reason why. And those who are younger than the age of 65 are able to book appointments in other locations. It's just to make it easier for older New Yorkers. That's why.
Very good. Thank you, Dr. Ige. For someone who has lung disease and wearing masks creates breathing difficulties, can a face shield be worn as an effective alternative?
The face shield doesn't confer the same level of protection that a mask does. If you have any reason why wearing a mask is difficult for you, we will encourage you to take other precautions. But we are dealing with droplet infections here. So we need something that goes over your nose and goes over your mouth to offer full protection. We have recently updated our face mask guidance even to recommend double masking even when that is available. Again, because we have new strains available now, we want everyone to be protected. So if you're not able to wear a face mask, you will have to be more careful about where you go and limit your exposure.
Dr. Ige, is my understanding correct that if you have a KN95 mask, only a single KN95 is okay because it provides the seal? However, if you have a cloth mask or something substandard to the KN95, then you are encouraged for a double mask. Is that correct? Because the most important part is the seal around the mouth?
Right, that is correct. If you have a KN95, that is sufficient. But if you're wearing a disposable mask or a cloth mask, you will get additional benefit if you double that.
We had a question here. Just like vaccines are not mandatory, face masks are not mandatory, correct? Go ahead. We're encouraging you to get vaccinated, to get swabbed, to wear a face mask. We can't, nothing is mandated, so to speak, at this point, to my understanding. But highly, highly, highly encouraged. And we want the safety of our communities, of our city, and this helps contribute to those safety, to that safety. Go ahead, Dr. Ige, if you want to touch on that.
I think you said that just right. I can't add any more to that. That's
Great.
it.
You have a fan club here. Kudos to Dr. Ige. Her way of explaining things is very comforting and helpful. We think so too. That's why we're proud to co-sponsor this event with her. She's phenomenal. Thank you so much.
Thank you for having me. This is my community, so I want to make sure everyone is safe. I live in Queens as well.
We're happy to hear it. Another Dr. Ige fan. Dr. Ige, thanks. Great job. You really explained the process very well. Thanks again. I took the first vaccine and feel very well and am due for my second shot next week. I strongly encourage all of my friends and family to get vaccinated. Thank you so much for sharing.
Yeah, thank you for sharing. That's important.
Dr. Ige, to personal question, feel free to not respond if you'd like, but has Dr. Ige had the vaccine herself? We need more people in higher places to tell those who say they do not want the vaccine to hear those who have gotten it.
Yes, I have taken the vaccine, and I had soreness the second day after the shot. It lasted for 2 days, so I was sore in my arm for about 2 days. I did not have a fever. I did not have a headache. I was still able to work. So not everyone reacts the same way. I know that some of my colleagues, they felt a little under the weather for about a day or two. So again, it's not everyone who has those symptoms, but I had that soreness in my arm for a couple of days. And so, yes, I have taken the vaccine and I'm here and I'm doing well.
And she's a role model. So we want strong role models to help encourage this. I'm unfamiliar with this next question, Dr. Ige, but I will present it to you. What is the CDC VAERS reporting system?
Yes, so that's the Vaccine Adverse Event Reporting System. It is a system to ensure that all adverse effects following vaccination are reported by providers. So it's an easy way to see if there is anything out of the ordinary that is happening after vaccination. So it's another safety system that's been instituted to make sure that there's tracking of whatever adverse effects is happening with this vaccine. In addition to that, there's also VSafe. This is a smartphone-based app for anyone who gets vaccinated. You can download it and you can report personally if you have any side effects. It's another way to keep tab on what people are experiencing after this vaccine, and not just limiting it to the provider, but that individual can report how they're feeling or any symptom they're having after the vaccine.
Dr. Ige, we need a vaccination bus that could go around the city vaccinating those who are too frail to go to vaccine sites. This is the reason many seniors won't go. They don't want to wait on those long lines. I will double down on this and say that our constituent team, I believe, we've also received constituent inquiries about if and when home vaccines will be available and administered to specifically our seniors and our homebound. I've not heard updated information on that, but if you could touch on that, that'd be helpful.
Yes, the mayor actually, released some information last week about the plans for seniors who are homebound, and that's a priority right now to make sure that's ruled out. There's a limitation though for now, which is that the current vaccines we have, the Pfizer and the Moderna, they're very difficult to transport around. They require very strict handling and storage. So it makes it difficult to carry to the home for vaccination. So the plan right now is when we get the Johnson & Johnson vaccine authorized, that is more stable to transport around. The mayor, there is already a plan and to identify where there are seniors at home so that they can be vaccinated at home. So that plan is in the works. The second piece of this is that, to make sure seniors who are homebound are protected, there is a plan now to vaccinate home health aides to make sure within the next month, 25,000 home health aides are vaccinated so that they're not exposing seniors who are at home to the possibility of infection. And then finally, there are some plans to do vaccination on site at retirement communities. I know that there was one in Queens last week and in Brooklyn. So those are some strategies that are ongoing right now. But until we have that new vaccine that is easier to transport around, we will not be able to do vaccination at home just yet.
Thank you. I think the next question is geared more towards my office. Why were some politicians given the vaccine when they did not qualify by age, etc.? I cannot comment on other offices. I don't know what their qualifying parameters were. However, I will say that it's my understanding the borough president is not getting vaccinated at this point. When appropriate, he will publicly get vaccinated. But before he could get vaccinated, the stance in our office and by the borough president is that he wants to needs to prioritize healthcare workers, frontline workers, first responders, educators, seniors, people with disabilities, people with pre-existing conditions, and all vulnerable communities to get the vaccine. So that's our ideology on the topic and our standpoint on the topic. As far as other offices, I cannot speak to that, but thank you for the question. This is interesting. Is it true that you should not take aspirin or Tylenol before you take the shot? If so, why? Follow up, after taking the vaccine, should you rest or can you continue regular activities?
Right. The recommendation right now is not to take, pain relievers or Advil or fever reducers in advance of the vaccine. You remember that this vaccine is supposed to help stimulate your immune system to develop antibodies, and we want that system to happen unhindered. But if in the production of those antibodies you get some symptoms and it makes you really uncomfortable, and you then need to take pain relievers or Tylenol or Advil, then it's okay at that time. But we want your body to be able to develop that immunity without any hindrance. So we don't recommend that you take it in advance, but you can take it if you have symptoms. So that's a recommendation. Secondly, should you rest? It depends on how you feel. I was able to go to work after my vaccination. I didn't feel down or anything. I had the soreness in my arm, but I put some ice pack on it and I was good. Some people feel, they have a little headache, they feel, tired, and they want to take a day off to get better. So that's also fine. But there's no blanket, recommendation for you to stay off work or to do anything different or unusual after a vaccination.
Are vaccines presently given to ages 20 to 29? I believe it's if you qualify with one of the underlying conditions, correct?
Right. That's right.
Or if you're a teacher or if you're a frontline worker, something like that.
Right.
On the a follow-up to an earlier question, on the CDC VAERS, there were over 900 deaths reported. Can you comment?
Yes. So on that website, we ask the VAERS system encourages reporting on any event. So the investigation that happens then tries to find out if that event is related to the vaccine or not. So one thing we do is we know that people die every day. And so information about the number of deaths that happened among those who took the vaccination is compared to those who did not take the vaccination. And so we compare the rate in these two groups and see if there is a difference. So if we observe that death is happening at a higher rate among those who are vaccinated compared to those who are not, then we will be worried. But if we see that, the people who are dying every day are similar, and there's not a higher rate of death among people who are vaccinated, then we are not able to say the vaccine has caused the death. So yes, there are deaths reported, but there is no link now to the vaccine because that occurrence is not any more than what we'll expect in the general population. So that's how that is interpreted. So the data right now has not linked death to the vaccine.
Another Dr. Ige fan, please come back again, Dr. Ige, if time permits you. We could work on that. Is it true that it is not recommended to receive the vaccine if you're allergic to penicillin?
Right now, penicillin allergy has not been shown to be related to vaccine allergy for this particular vaccine. So the only instance where you want to be cautious with this vaccine is if you have had a reaction to vaccines in the past. But if you have severe allergies and you carry an EpiPen and you're not certain if there's any ingredient in this vaccine that you're allergic to, we want you to check with your provider first. But we want to let you know this vaccine does not contain eggs, it doesn't contain latex, it doesn't contain preservative, it doesn't contain pork products, gluten, gelatin, none of the common allergens that people react to. So allergies to food, allergies to pet, allergies to pollen, they're not a worry for this vaccine.
What if someone has tested positive
Mhm.
for COVID-19, waited the 10 to 14 days, has then tested negative?
Right.
How long after them testing negative, without any other type of injection or intervention not needed,
Mhm.
can they get the vaccine? Can they get it immediately
Yes, they can.
or relatively immediate after?
Right. Previous infection with COVID is not a barrier to getting vaccinated. However, we're recommending that people wait 90 days after they recover because during that period, they still have antibodies, so they're still protected to let others go first.
So the fear, maybe the word fear is wrong, but the concern is that your body's already defending itself because it has the antibodies. So the vaccine would not add any layer of protection, so to speak, or would not add as much protection?
No, the recommendation to wait is not because of any negative impact of the vaccine. You can go take your vaccine tomorrow after you recover. But we want to give others a chance. Others who don't have that protection that you have temporarily to go ahead. So people are able to take their vaccine immediately after they recover. There is no negative impact. So the recommendation to wait is more to give other people the opportunity to go first because you are still protected within that period.
But that doesn't lessen the effective rate of the vaccine for you.
No.
Are any of the vaccination sites in New York City a drive-through site, such as the state site at Jones Beach? Perhaps Citi Field would be appropriate.
For the vaccination, drive-through is not may not be appropriate for a number of reasons. People need to be screened. People need to be observed for 15 minutes after the vaccine to be sure there's no reaction. So that needs to happen in a setting where people can sit comfortably and they will be observed after their vaccination to be sure there's no reaction. And so a drive-through is not necessarily the best way to do that for now. But there are locations, there are pop-up sites, there are mobile sites that are being worked on, but not a drive-through as yet.
Similarly, and we've seen a bunch of pop-up sites throughout Queens over the last few weeks, there was a site in the Allen Senior Building last weekend, but seniors in the building did not have a chance to get registered because the registration link was sent out to the community at large. It was terrible to have people come from outside the building community to get vaccinated in a senior specific building, and the seniors living in the building could not get vaccinated. The city should make those sites only for residents. We must do better. I think the city and state are seeing things like that where they're able to lock the zip codes for a certain amount of time so the populations where the site is put up could have first access to those sites.
Right, that is happening now, and that's a lesson learned that we want to target or narrow registration to particular locations going forward.
Is it true you can't travel unless you get tested? Isn't testing voluntary for travel?
Yes, testing is voluntary, but if you're going to be a risk to your fellow American or fellow New Yorker, then you want to make sure that you're taking precautions to be sure that you're not a source of infection to others. So that's why travel is required. So airlines require you to provide evidence that you're not sick, and that requires testing. So that's what's happening there. The same way, you know, if you're going from one location to another, you want to be sure you're not, you know, being a source of infection in transit or when you get to a destination.
Correct. This is a good feather in the cap for Dr. Ige. I am the Health Committee Chair at Queens Community Board 7. Would Dr. Ige be available to speak at a virtual Queens Community Board 7 monthly meeting, perhaps in March? You don't have to put you on the spot right now.
No, I am happy to be put on the spot. My job is health equity capacity building. So if I am not able to be there, someone on my team will be there. Just let us know when and where.
Sure, and CB7 could reach out to Queensborough Hall. We have very strong relationships with our community boards, or you could contact our general line, info at queensbp, as in borough president.org. That's ORG, so that's info at queensbp.org for any further follow-up questions. I'm gonna have one more question, Dr. Ige, if that's okay for you. If time permits, as a follow-up to the drive-through question, Jones Beach has an area in the same parking lot where the 15-minute monitoring takes place. What would you say to that?
Yes, if there is a location where the monitoring can take place, then that will be fine. There is exploration of a lot of community sites right now where vaccination can take place. So yes.
And you could forward those recommendations to Queensborough Hall. Again, info at queensbp.org. We've logged a number of constituent inquiries and recommendations and are keeping track of those inquiries. So if the community has any recommendations they'd like to present, our office is always here as a resource to listen to them.
Right.
And with that, Dr. Ige, thank you so much for taking the time. We really appreciate it. Extremely thorough presentation. We learned a lot and couldn't have asked for a better presenter. So thank you so much.
Thank you, Brent, and thank you everyone for the opportunity to be part of this conversation. Please stay safe, wear your mask, wash your hands,